If I can show you an affordable, eco-friendly, and safe technology that will reduce microbial contaminants in the air and protect surfaces from mold, volatile organic compounds, or VOCs, bacteria, and viruses without the use of dangerous chemicals, and that operates without the need for compliance by patients and staff through your existing HVAC units to purify, not just filter, the entire treated airspace, would you be interested? Why upgrade your HVAC? 3 reasons. Patient safety, of course, is on everybody's mind today, and patient safety is the #1 reason that we would consider an upgrade of the HVAC system. Our technology saves you money. We have a couple of links here. One is from the CDC, which talks about the cost, the direct cost to hospitals for HAI, health-associated infections, and then this gives the benefits of prevention. But we're just going to read the summary here where it gives the big numbers. Now these numbers are from 2007, so you know the price of nothing goes down. So the medical costs, the overall annual direct medical costs of HAIs to U.S. hospitals range from $28.4 to $33.8 billion. That's 2007 dollars. And also up to $45 billion. Next, we're going to go to Reduce Infection Death. That's a organization, Betsy McCauley's Committee to Reduce Infection Deaths, and she has a box in here with the estimated costs of hospital-acquired infections in the U.S. 2 million estimated infections per year. Now that's a larger number than the CDC claims. However, we know that their amount of HAIs are thought to be underreported. Now, compliance. We have issues of compliance with every other infection method that we use. Terminal cleanings, they are effective, but once they wheel them out of the room, then new contaminants can come in, and you have a false sense of security because the room is not clean anymore. The temporary versus continuous is a huge issue because our system goes in a duct and is 24/7 and bringing hydroperoxide in a gaseous form everywhere the air handlers put the fan runs and the air handlers go to the surfaces and airborne contaminants. So patient safety. We want to take a little look at patient safety because there are more deaths due to hospital-acquired infections than AIDS, breast cancer, and car accidents combined. When I first read this statement, I thought that it must be wrong. You've got people marching up and down the streets in pink shirts. You've got all kinds of focus on AIDS, but you hardly ever hear anything about hospital-acquired infections. And yet 1 in 20 people that goes into a hospital comes out with an infection that they did not have when they were admitted, and on discharge, those are often what bring people back for within 30 days for readmission. Now, Adam Boris is the CEO of ICNet Systems. This is I believe they originally started in the UK, but they have a Chicago branch. This is a surveillance system. I believe it's a software surveillance system for hospital-acquired infections. And just about 1 year ago, Adam was quoted as saying, as a host of new government payment penalties and reporting requirements take effect, preventing hospital-associated infections is becoming a matter of financial survival for hospitals. I really like that quote because a lot of people are looking at the cost of the systems. Even the terminal cleaning systems are very expensive. But for our system, there is an investment. But avoiding the upgrade and not choosing to do that is going to cost you in penalties. It's going to cost in human lives. Now, the question, are your current solutions temporary or continuous? Obviously, if you're not using AirMD's Induct system, your solutions are temporary. Washing your hands is a temporary solution. It's a temporary solution that requires compliance. You can't force people to wash their hands. They have been beating the wash your hand drums for years. People touch computers. They touch their iPhones. Those are not normally treated with bleach. Actually, in some of the hospitals where they have the UV light component terminal cleaning, and BioQuil, which is a hydrogen peroxide in a mist form, which has its own problems, but they're actually putting things in the room while they run these. You cannot have patients in the room while you're running these systems because they're unsafe for patients. So they have to bar the door. They actually have a automatic shut-off on the Xenix unit. And even though these in their place, they're good, they're not continual, and they provide a temporary feeling of safety. So we want to see you upgrade your HVAC for continual air and surface. Kansas State University, Dr. James Marsden has done the testings, and we are providing the test booklet that show reduction in MRSA, H1N1, C. diff, and norovirus, just to name four of the top most ones that are most talked about. But there's a numerous other microbes that are also, and personally, every microbe that we test on, single cell organism, which is very expensive to go through the testing, but every one that we test on, that they find that it's effective against that. So this is an excellent continual solution to indoor air pollution, which the EPA calls one of the top 5 environmental health risks. And we would like you to take a look at it. We can do a walkthrough for you. We can show you what it would cost for your facility. We're just excited about being able to offer you a permanent solution to your indoor air pollution in hospitals and medical facilities. Thank you.